placeForDad.com, also known as foremost residential care facility in Hesperia. This is Consumers Dr. Bengala. Today I'm going to talk about the differences between a home care and a residential care. Actually, I'm looking from the Homestead, which is a home care business. It is on their website. I will go line by line, see what is it they're trying to tell you, which is accurate or not. I will clarify that because Foremost is a residential care facility. When people think of the care, many people automatically think of a caring home or residential home. What is residential care, you may ask? Yes. Residential care involves, look at it this way, someone leaving their home, memories, belongings to relocate into a facility dedicated to round-the-clock care. Part of it's true. I just want to make sure. Some residential care homes allow residents to come and go as they please, where others are more secure to protect their vulnerable residents. That's exactly right. Where I differ, the point of view is leave their home, memories, and belongings. As a matter of fact, they can bring all their memories and belongings to a residential care, and you have a camaraderie in a residential care, unlike home care. This is where, the big difference is you are not lonely at home, you're not isolated, and you have bunch of folks of this same age, so you have a better camaraderie and interaction with fellow seniors, unlike being home isolated. This is where I differ from the Homestead website. Then they define what is home care. This is from Homestead website. Home care is looking after a person from the comfort of your own home. Yes, I agree. Caregivers going to the house to help with the day-to-day aspects of living, such as home help, personal care, and companionship. Home care is flexible and can be anything from a couple of visits a week right through 24/7. This is where the costs differ. You need to realize home care can be very expensive, but they're not going to tell you that because they tell you only they will visit a couple of times a week. Whereas residential care, you have the care nonstop, 24 hours a day, and you're you're in companion with fellow residential care residents, so you can get to interact with a lot of senior folks, which they're not mentioning here anything. Let's again, the difference between a residential care and home care, they bring up the point again. I will read it through as I see it. Home care. We already mentioned you stay at home in familiar surroundings, live on your own terms. You decide when you eat, sleep, and watch television, enjoy the company of pets, see friends and family when you like, and enjoy companionship from caregivers. Most of the things are true, yes, but they don't mention they don't mention you about loneliness when your children are not around, living lonely at home. They don't mention that in the home care because they want to visit caregivers go to the individual homes and they charge you by the hour. They don't tell you that. They charge you by the hour. Unlike a residential care, you have a flat fee. There is no upcharge, and you have being taken care of non-stop 24 hours a day. Unlike home care visits, which are only twice a week, and also if they go on every day, well, the bills pile up. They don't mention that. Home care could be very expensive. What is the difference in residential care? They talk about residential care. Again, look at the way they put it in the words at the website. Move into an unfamiliar environment. That's not true. It is not true. Eat meals and go to sleep at set times. Not true. Pets are usually restricted. Not true. Visiting times are usually restricted. Not true. It's interesting how they try to mislead the public. This is from a homestead. I'm reading right from their website, folks. Not companionship based. Not true. You have more company, more friends, and there's more seniors around you, and you get to interact with fellow seniors. They don't mention anything. It's just unlike being home isolated by yourself. Not one-in-one care. Yes. One-in-one care. Home care is one-in-one care. Instead, in the residential care, the caregivers take care of a bunch of folks. That is perfectly true. But you're being charged for at a flat fee, irrespective of how many hours they come and see you. There is a fixed fee. Unlike home care, the more visits they make, the more bills pile up. They don't mention that. The next topic, what they say, how do I know which type of LLA care is right for me? That's a good question, folks. Yes. I'm reading right from the Homestead website, folks. Again, I have no qualms about comparing with the home care and residential care. Deciding whether home care or residential care is right for you depends on your needs. Yes, you're right. That's perfect. When you have the conversation about care, it is worth getting an assessment of your care needs from your local council. You can book a free consultation with us. This will help you about the best care solutions for you. Same thing in residential care. There will be an assessment, and basing on your assessment, it is up to the family and the resident to decide if she can take care of herself when caregiver is not around, or she needs to be constantly supervised. If she needs to be constantly supervised, that home care could be pretty expensive. It could pile up to $8,000 to $10,000. I'm not kidding, because if you bill by the hour, caregiver bills by the hour, whereas residential care is a lot more economical. They will never mention it there, because this is what Homestead is trying to convince you, that home care right at home is the best. Well, it's up to you guys to decide. I'm not going to tell you which way, but I'm just giving you the facts from Homestead website. So if you're looking at the care options, the website basically says letting someone provide care for you at home can be very personal experience. So all depends on you guys. It all depends on the resident. I understand staying at home and with all the friendly environment. I understand, but people feel lonely when they get to certain age at home. There's nobody around you. When caregiver is not around, there's nobody around you. That's they fail to mention that because caregivers comes in for fixed hours, folks. Not they are not there 24 hours a day. So again, they tell you every home care service offer tailored to your needs. That's true. You decide the level of care and support you need as long as you want. Whereas residential care does the same thing, but there is more companionship, more senior folks around you, and it is almost like home. I don't see any difference in a home care setting and elderly residential care facilities because once you get used to your facility, a lot of folks in the foremost residential care facility have been here for 20, 30 years. Because if you're looking at the home care for 20, 30 years, it's impossible because the care can be cost prohibitive. Whereas in the residential care, it's a fixed cost and it is a lot more economical. Home care services, they talk about companionship, housekeeping, personal care. Dementia is definitely better in the residential care than a home care because dementia, you could be, it's hard to take care of the dementia residents at home without anybody around you, unless a family member is at home. You really need a constant care. Palliative care, yes, residential care does the palliative care. They also do live-in care. We do respite emergency room home care. We also have respite care in the residential care facilities. And folks, I can give as much information I can, but it's up to you to decide what you feel comfortable. If you want to be among the senior folks, residential care facility. If you want to be all by yourself, if there's no family at home, when caregiver is not around, you're all by yourself with a pet, obviously. But some of the residential care facilities they let have the pets too. So you really need to look at the individual residential care facility. And as far as the technology, whereas in a residential care facility, have they all have amenities with tele. You can FaceTime with your family members. They can come and see you at any time. You could be in touch with your family at any time. You're almost like spending the time at home, and you're very safe under the supervision of caregivers. And it's almost, and once you get used to it, it's almost like home. I don't see any difference. The main thing which I would look at is the cost of the care at home compared to the residential care. So look at individual needs and the budget, and there are a lot of technology. There are tablets, home monitoring sensors. You can talk to your family members like any other place, So residential care facilities are quite homey, folks, quite homey. And they do provide the advice and support. Aging can be a challenging time for both the person is getting older and family who is seeing them change. Growing old can prevent you from doing what you used to do because of deteriorating physical and mental health. And as I said earlier, you feel lonely if you are at home rather than being in a facility along with the companionship of fellow seniors. That's you don't get it at home care. Being home is very lonely. Understanding and preparing routine activities, nutrition is important, and the goal is to prevent hospitalization, prevent falls. That's another thing, falls. It is prevalent. The number one cause of death is hip fractures and fall injuries and senior folks. And that's when we really need a constant supervision in a facility like a residential care facility. And if the caregiver is not around at home, then they're prone for falls. That's another thing we need to look into that. Dementia care is definitely much better in a residential care facility than being at home. Yes, folks. And what else we need to talk about? As far as if you want to visit the facility, you need to log in at placefordad.com or place number 4 parent.com or foremost assisted living facility.com. Once you go, you can have a virtual tour of the facility. You can also give them a call, 760-244-5579. They can address all the concerns family have on their loved ones. So residential care facilities are very convenient. They can visit their loved ones at any time, and you should check and call that number 760-244-5579 to find out if you need any further information. They do provide the respite care. They do have hospice, and we have hospice nurses coming and taking care of the folks in a residential care. This is not a nursing home, folks. A lot of people tend to believe nursing home is very different compared to residential care. Residential care is under the community care license, whereas a nursing home is like a basically a lot more sicker residents, and they're mostly bedridden, wheelchair bound. Whereas in the residential care, people are most of the time they can take care of themselves, and they need not only supervision, they need some assistance, bathing, changing clothes, taking them for a walk, taking them around on a wheelchair. Things like that can be done in a residential. And we have nice courtyards. Seniors can walk around in the courtyard, and we'll have a beautiful, view of the mountains. We do also have event hall for, family gatherings. We do weddings, banquets, quinceañeras. So we have a beautiful event hall upstairs for people to celebrate. If they want to celebrate with their loved ones, they can use the event hall for a family celebration. Guys, if you like what you hear, hit the like button, subscribe, share, and thank you for joining us again. We will see you in the next episode of placefordad.com. Thank you. God bless.